Okay, the AUA, which is the American Urologic Association, has guidelines on how we're supposed to treat overactive bladder, and there's 3 levels. So first line therapy is pelvic floor strengthening along with behavior modification. Second line therapy are medications, and third line therapies are more advanced things. I'm going to go over those in a little bit more detail. So pelvic floor strengthening with behavior. The behavioral things are like managing constipation, avoiding caffeine, making sure you urinate before you go out to the store, and make sure you urinate, before you leave the restaurant. Timed voiding, watching how much you have. Don't have a whole bunch of fluids before you go to bed. These kinds of things. Doing voiding diaries. I have a lot of people do voiding diaries to see how much urine they're making at night, because there's a difference between the production of urine and the control of the bladder. And we all make more urine at night as we get older for several reasons. One, we make less antidiuretic hormone in the brain, which is a hormone that tells the kidneys to slow down. We're sleeping, so it would concentrate the urine. So the kidneys are just going on like they are during the day. Second thing is, even if you don't get swelling in your ankles, as we get older, we do collect more fluid in our tissues, and then when we lay down and all our tissue is the same level as our heart, that gets reabsorbed, and your kidneys are just doing what they do. They see more fluid and they have to get rid of it. So I'll tell you a trick that I tell my patients. It's kind of an easy way to figure out how much urine you're making at night. If you have a scale, weigh yourself before you go to bed, then weigh yourself in the morning after your first morning urination. The only weight you lost was the urine that you made during the night. 16 ounces weighs a pound. So if you're losing 2 or 3 pounds at night, then you're going to have to get up 4 and 5 times because you're making a lot of urine. If you're only losing a half a pound, you should be able to sleep through the night. At the pelvic floor strengthening, you can do Kegel exercises on your own, or you can do pelvic floor rehab, which I said helps stress incontinence. That's the only thing that helps stress incontinence and urge urinary incontinence is pelvic floor strengthening. But pelvic floor rehab works very, very well for overactive bladder.